Okay, happy Saturday morning. We are going to record chapter 22. Hope you all have gotten some rest after your PEDS HESI, and I know after my Joint Commission and trip to Louisville, I had a little sleep in a little bit, and it's going to be a beautiful Saturday day. So chapter 22 talks about the transition to parenthood, and I have to say one of my favorite parts of being an OB nurse is seeing the bonding between the family, whether it's a first child or a fifth child. It is one of the most special things as a nurse, a labor nurse, an OB nurse that you can be involved with, and what you can do to facilitate this transition. If there are any type of problems that is going on within the family unit, but it truly is just one of the most rewarding parts of being an OB nurse. So here are your objectives. And we're going to start out this slide talking about parental attachment, bonding, and acquaintance. And probably the key word on this slide among the definitions is this word here of process. So we know parenting is a process of role attainment and role transition, and this transition is an ongoing process as the parents and infant develop and change. So there are, we talk about skin to skin, and those first hours and days and weeks are so important for bonding and learning behaviors of the mom, learning behaviors of the baby, and responding appropriately back and forth. But there are also things that can interrupt this normal process. On Thursday in class, we talked about postpartum hemorrhage and how that can delay milk. A breastfeeding mom, but those moms feel terrible. They take weeks and weeks to recover. If you have a mom that has postpartum depression, if you have a mom that has an emergency C-section and she doesn't get to see her baby right away, if you have a baby that's adopted, and other countries, babies are abandoned. But just think about this is a process. So all of these are important, but they happen at different times. The earlier, the better, but just know this is a process, and some things can interfere, but it's how the parents respond to this: attachment, bonding, proximity, mutuality, acquaintance, and claiming process. It's how that they appropriately respond to the baby's cues. For instance, if a baby is hungry and you feed it, that that helps. If a baby is hungry yet nobody responds to a baby for hours and hours and hours, whether it's a severe case of neglect, whether it's a knowledge deficit, or just whatever, it's a process that when you put that baby in a position where they do cry and they do get fed, they will catch up developmentally, if that kind of makes sense. So just remember it's a process and things can interfere. So here are the definitions that I really stressed in class on Thursday, that you need to know the definition. That's those basic level questions, but with every one of these you need to be able to apply it in different situations. So there are several examples in your book. I will give you a few of those along the way, but when you study your notes and make your notes, make sure with every definition you have some type of example that you can put with it to apply it. And this isn't just all about the passing the test. Like I said, it's also in passing your NCLEX, and it's also preparing for practice in the OB setting with your clinicals and for those that go on to be labor nurses. So the first definition in this process is attachment, and this is where parents come to love and accept their child, and vice versa. The child comes to love and accept the parent. Second definition is bonding, and this is the time after birth when the child and the mother, when the infant and the mother have very close contact. Next is proximity, and this is combined with their parents' interactions, where you want positive feedback and non-verbal responses between the infant and the parent. An example of this would be a grasp reflex. The grasp reflex, which is actually shown in this picture, is a natural process. So it's a normal response that when babies' hands are open and you stick something in their hand, whether it's your finger or an object, that they grasp that. They close their fingers around it and hold on tight. That's a very rewarding response for a caregiver, whether that's a mom, a dad, a grandparent, and even nurses. It's a very relaxing and rewarding response to see that response. So even though that we know that that's how they're supposed to respond, for a mom that doesn't know that that's a reflex and that the baby responded, it's very rewarding. So you can see in this picture that this is a preterm infant, more than likely. It's a small baby. You can see the skin on the baby's hands is very thin and kind of transparent, so it's a preterm baby, but you can also see this baby is on oxygen and holding her mother's finger. And you can see that they're also sharing eye contact, so there's lots of good things going on in this picture, but the grasping of the finger would be an example of the proximity. Next is mutuality. Mutuality. It's when the infant's behaviors elicit corresponding parental behaviors. Next is acquaintance, and this is where they share, the mother or the caregiver and the infant. This section is really focused a lot on maternal, but it is important for anybody caring for the baby, but it's really focused on maternal. So the acquaintance is when they share eye contact, touching, talking, and exploring to become acquainted with the infant. The claiming process is when they identify themselves with their new baby. What are the likenesses and differences of the parent's characteristics? So, for instance, they may say, the baby's nose looks like the mom, or has long fingers like dad, or long toes. So they point out characteristics of the baby and see who does the baby look like, or who does the baby not look like. Mothers can react negatively during this claiming process if the baby is not the gender that the mother had hoped, or if there's a congenital anomaly that makes them, kind of in quotations, not normal, that they may have a problem, have a hard time adapting to that. If you look on table 22-3 on page 504, there is a list of parent-infant attachment interventions, so if there are any concerns going on, kind of what you can do to help facilitate that. Okay, so that covers the process. The second part of this is the assessment of attachment behaviors, and this is the assessment of parent-infant attachment, relies on skillful observation and interviewing, so you as the nurse. How do the parents console their child? What kind of eye contact is involved? So if you look on box 22-1 on page 505, that's good to review. Okay, I think you all have had early contact and skin-to-skin with Miss Adamson at the beginning of the semester. So, basically we know early skin-to-skin is very beneficial for not only preterm babies, but full-term babies also. Promotes early and effective breastfeeding, so mom and baby really get to know each other, and it helps basically promotes, when you have skin to skin, the babies have unlimited access to the breast and can eat and suckle as much as they want. It's that transfer of hormones and that suckling that increases mom's milk supply to make sure she has enough milk for her baby. And it can facilitate the attachment process. There is no doubt. Okay, so you also hear skin-to-skin contact and called kangaroo care. Just know that kangaroo care or skin-to-skin was developed in countries that don't have the technology that we have to support these premature babies. So, and an incubator is what helps keep babies warm. So in other countries, moms were encouraged to do continuous, constant skin-to-skin contact. So to keep their babies warm, to help stabilize their vital signs, and to promote their breastfeeding and weight gain, because in a lot of foreign countries, breastfeeding is the only option that they have. They don't have the option of formula and that type of thing. So the babies have unlimited access to breast milk to help them feed and grow. So kangaroo care is not on the test, but that just kind of ties all this together, especially with in the hospital you hear kangaroo care very often. Extended contact. So a lot of hospitals have moved towards couplet care or rooming in, and so what this is the baby stays in the room pretty much all the time. Some hospitals have even the pediatricians and the nurses do all of their exams and teaching right at the bedside, so the baby isn't taken to the nursery just because the pediatrician is there. The pediatrician rounds in the mom's room. Now, they probably go to the nursery for any kind of interventions or, for instance, circumcisions, blood draws, hearing screen, that type thing. But that's what couplet care and rooming in is. This optimizes family-centered care, which is very important to the generations right now that are having babies. That family-centered care, giving them privacy, teaching them together is very important. It also helps. Extended contact is good for at-risk populations, including adolescents and low-income families. It pretty much makes them take care of their baby, and as the nurse, it allows you to assess, are they paying attention to their baby's cues and are they meeting those needs? Communication between the parent and infant. All of the senses are very important for both the mom and the baby. So there are a few examples in your book, and we'll kind of talk about them very briefly about, for instance, if a mom is blind and the baby can't see the eye contact because the mother's eyes make no reactions, what they can do, like increase the pitch of their voice, have very animated conversation, what they can do if they can't see their baby, how they can stimulate the other senses. So this would be kind of what we would consider the normal. So touch begins at birth. Parents start out, some are very afraid to touch their baby, afraid they're going to hurt it, but we know babies are very resilient and respond very well to touch. So they'll start out with just kind of their fingertips, and they're using their whole hand, and before you know it, they've got the baby in this position that we call the in face, which promotes eye contact. So with this position for eye contact, this in face position, the baby is about, the mom and the baby's faces are about 12 inches apart. You dim the lights so the light doesn't bother the baby's eyes, and you also want to delay instilling the antibiotics, the eye ointment, so the baby can clearly see their mother. Babies respond for voice to high-pitched voices. They respond very well to that. And when we talk about odor, babies can smell their mother's breast, and they can smell their mother's breast milk. So it's important to, make sure you're stimulating and all of the different senses in this dyad of the mom and the baby. The next definition is entrainment, and this is where the baby moves in time to the parent's voice. For instance, they dance, maybe with their arms. It's just what we're looking here for the communication is there is a stimulation by the mom, and how does the baby respond, or vice versa. There is the baby is crying, and how does the mom respond to the baby. The next is biorhythm intricity. The baby is in tune with the mother's natural rhythms. So some examples here, the baby's heartbeat is very soothing to an infant. And another example would be that the mom takes advantage of the alert state, which we'll get into the different states, alertness of the baby when we get into newborn. But the mother takes advantage of that alert state for interacting with her baby. For instance, if her baby is tired, it's not a good time for her to be in this in-face and trying to talk to her baby and get responses of her baby. She recognizes the baby is tired and lets the baby go to sleep, but takes advantage of this social time during the infant's alert state. So basically she is responding to her baby's cues if her baby is awake or her baby is tired. Reciprocity, and this is the type of body movement or behavior that provides the observer with cues. It takes several weeks to develop. So an example would be that a mother comforts her fussy baby to sleep but does not overstimulate the baby. So she's responding to what the baby needs. And the last is synchrony, and this is a fit between the infant's cues and the parent's response. So an example would be an infant develops specific cry in response to different situation, and the baby responds to that appropriately. And you know, if you have kids or been around kids, they have a different cry for if they're tired, a different cry for if they're injured, a different cry for if they're scared. And so that takes a long time to develop those different cues and for the parents to recognize them.